Hey everyone, welcome back to another video. Being diagnosed with a chronic illness will inevitably change your life and your lifestyle in many ways. In today's video, we're going to be taking a look at a few different responses that an individual may have when they are diagnosed with a chronic illness. Denial. This is a defense mechanism where people avoid the implications of an illness. This is very commonly seen in chronic illness patients, where these patients might act as if their diagnosis is not so severe and that it'll go away shortly, or that it doesn't pose many long-term implications. Immediately after a diagnosis, denial can actually serve as a protective function, as it keeps the patient from having to come to terms with the full range of problems that are associated with their disease, at arguably the time when they are least able to do so. Denial can also mask the fear associated with the disease until the patient becomes more accustomed to their diagnosis. That being said, during the rehabilitation phase of an illness, denial will have adverse effects if it interferes with the patient's ability to take in information regarding their treatment and self-management program. After the diagnosis of a chronic illness, anxiety is very common. Patients often feel overwhelmed by all of the potential changes that are about to occur in their own lives, and in severe cases, the prospect or the idea of death. Anxiety is not only intrinsically distressing, but can also interfere with our adaptive functioning, or how well we're able to cope with our new situation. Anxiety can actually increase the severity of an illness. For example, in a heart disease patient, higher anxiety will lead the individual to be at higher risk for subsequent heart attacks. Finally, symptoms of anxiety may be mistaken for symptoms of the underlying disease, and can therefore interfere with the assessment of the severity of the illness along with the treatments necessary for the individual. Depression is a common and often debilitating reaction to chronic illnesses. There is evidence to suggest that depression may occur later on in the adjustment period compared to denial or anxiety, and it can often occur intermittently. Among Canadians who have a chronic disease, the likelihood of clinical depression is most prevalent in those with chronic fatigue syndrome, who are 7 times more likely to have clinical depression compared to the general population, and least prevalent in those who suffer from diabetes or heart disease. Again, depression is important, not only for the distress it causes, but it also has an impact on the symptoms we experience and on our overall prospect of rehabilitation or recovery. It can significantly worsen our health and our quality of life, and can also worsen the symptoms we experience along with complicating our treatments. So often, when we think of reactions to a chronic illness, we think of negative emotions. Research has even disproportionately focused on the negative outcomes produced by a chronic illness. The happy reality is, many people experience positive reactions to a chronic illness diagnosis, such as hope and optimism. It's possible that these feelings arise because these people feel that they have escaped death, or they've reordered their priorities in a much more satisfying way. They may also find and attribute meaning to everyday tasks that they at one time took for granted. In a research study, more than 90% of cancer patients reported at least some beneficial changes to their lives as a direct result of the cancer. This included having an appreciation for every single day and for deciding to do things now in life rather than to postpone them. These patients reported putting more effort into their relationships. They believed they were more aware of others' feelings, and they felt more empathetic and compassionate. An individual's ability to find these benefits, or what's referred to as benefit finding, plays such an important role in their ability to adjust to their chronic illness. Here, we discussed some negative and positive reactions an individual may experience when diagnosed with a chronic illness. This was not an exhaustive list. Thank you so much, guys, for watching. If you enjoyed the video, please like and subscribe, and I'll see you guys in the next video.